Hi, I'm Vicki Wessling here with City Speaks. City Speaks is a show that's brought to you by Mayor Wilfred Rosas and his administration. We're here for the residents for the city of Dunkirk and those in the surrounding areas to let you know what's happening with the mayor's administration and also to let you know what's available to you. We are very fortunate to have available to us today the new VA clinic that's just opened up here in the city of Dunkirk at the DNF Plaza. And we have with us Evangeline Connolly and we have Kelly Dragon. And these ladies are going to walk us through. We're going to take a brief tour and find out what's going on with the VA. So let's start a little bit. We just opened the building up, opened this up, had the grand opening on Thursday, and it was packed. And so now, how does this compare to the other facility that once was over in Dunkirk at the, what used to be the, I guess it's the plaza over there by Lakeshore Savings? Tell me some of the things that are new here.
Well, one of the things, we're really proud to be able to serve veterans here in the Dunkirk and surrounding areas because this actually is one of the first clinics that VA has had in the community. So we've had a clinic in Dunkirk since 1998. So throughout the years we've had different providers, different contract providers that have been able to provide care. But this is a larger new clinic, so we're thrilled to be here in this location, and hopefully it's easier access for people coming into the clinic.
Right. Well, of course, accessibility is really critical, and you have it here, and certainly there's the parking and the carts bus. But the other clinic was much smaller.
This is definitely a larger footprint as far as clinics are concerned, so we're thrilled that we are able to have a larger area for our veterans.
And now, Kelly, tell me a little bit. You service, the clinic services approximately how many veterans on a regular basis?
We service about 1,500 veterans on a regular basis.
So when we talk about 1,500, that is a lot. And that is, you know, one of the things that people think with veterans, we really forget or don't think about the female veterans. And so we really have a lot of female veterans as well. And we service them here also.
Yes, that is correct.
And so now some of the services that you're able to provide here that you were not able to provide at the other clinic, has that changed, or do we have greater services?
All the services are the same. We're hoping that within the near future we will add more services and increase our veteran patients.
Okay, and so we have the two doctors.
A medical doctor and a physician's assistant. And
then we have 3 LPNs, you said.
We have actually 4 LPNs here in the clinic. We have 2 for providers, 1 telehealth, and 1 lab tech.
And then we also have RNs.
There's 3 RNs here. There's 2 for the PAC teams, and then myself as the RN care manager.
So it's pretty very well staffed as far as that goes. And then you also have the other individuals who do some of the other work, the check-ins or the computer work and the tracking. We're going to take a tour, and we're going to talk a little bit about some of the things that we're doing here and the size of the facility as well. So let's take a quick tour and see what's happening. Okay, now Evangeline, you told me about the Veterans Service Officer. Am I saying that correct?
Correct.
Okay, tell me a little bit about that and what does that mean and to our veterans and what kind of services do they provide?
Well, we're very fortunate to have Dave Adams, who is a Veterans Service Officer from the Chautauqua County, to represent veterans in this area to help them file for other benefits in addition to health care. So what that means is there's a wealth of benefits that are out there for veterans, whether they need to file for a service-connected disability, a home loan, aid and attendance. There are many other benefits that veterans have and aren't really aware of it. So having him in this clinic is a great partnership with the county so that veterans and their families can come right here and access those services, and he can help them as well.
And so now it used to be, I think, that they'd have to go to Buffalo, or Buffalo was the one who did all of the enrollment and all of that, took all the data, all the information. We now have it here. And you also had it in the other facility, correct?
Actually, veterans can go to any VA clinic to enroll in VA health care. But in all the clinics, we don't always have the ability to have a service rep. So we're really thrilled that the partnership with the county is here right in this clinic. So veterans don't have to travel far to get and enroll in any of the other benefits and learn about them as well.
So the service rep really deals with things beyond health care.
Correct.
So there may be some other veteran benefits. So this is the place to come to if you're a veteran and if you think that there may be some benefits available to you, or if you feel like you just don't know where to go to find out what is available. Come right here to Dunkirk and they can take care of you. Okay, so now we're going to begin our tour inside, correct?
Sure. I'll let Kelly take the lead.
And Kelly, what are we going to see first?
We have 6 new exam rooms. At the other clinic, we had 4. So it's 3 for each PAC team. We have a handful of telehealth rooms, and I can explain what telehealth is. We also have social workers here, so they have some rooms there on the other side of the hallway for them. We'll also walk through the work area where our team gets together and works on a daily basis.
Okay. All right, very good. So let's take a walk. All right, so now we're going to come into our group care room, right? Now, Kelly, tell me a little bit, when we talk about the group care, what is that, what is it, and what happens in here?
This is a group care room where we hold meetings with our veterans. We hold twice a month. It's called a telemove group, and you'll see one of our telehealth monitors there on the desk. Our vets can come in here and meet with a nutritionist on the TV there that will go over several different items. Now that it's coming to the holidays, she likes to go over like tips on portion control with Thanksgiving dinner coming. We have about 6 or 7 vets that come in here twice a month to meet with her.
All right, so portion control is important. You can see I don't practice that very well. So they come in here, and so now they do the. Is this where any of the activity goes on? If they're dealing with any kind of social, with the social worker as well, or is this just for nutritionists?
No, if the social worker has a group, she can bring the group in here as well. It's for any type of group that the clinic needs to hold.
Okay, very good. So it's very spacious. So this is really nice to have this available to our veterans. Okay, so where are we going to head to next?
We have some telehealth rooms down the hall here to our left that we can go through.
I'm going to ask you to explain telehealth while you're talking about that.
Telehealth is it's a new technology that that we have here. I was actually the telehealth nurse for 5 years previously. You'll see the TV monitor there on the table. That's so that the veteran doesn't have to travel as far, maybe to Buffalo, to see a provider on the TV screen. The provider will come up on the TV screen there and we'll meet with the patient. It's all private, secure network, so there's no worries there with them. A lot of our veterans do choose to do this way so they don't have to travel far distances to get their care.
Okay, very good. All right, so let's head out to the telehealth rooms. Okay, so now we're in a telehealth room, and in this room it looks like you've got all kinds of equipment. Tell me a little bit about what goes on in here.
This is the room that we utilize for our telewound clinic. We'll bring the patient back here. Any patient that's being seen, followed at the Buffalo VA with the wound care clinic can come here for a telewound. They'll utilize this monitor here, and there's a handheld camera, and there's a specific program on the computer screen that the telehealth nurse can bring up so that the provider will be able to see the wound that we are looking at on our end as well. And then the provider will explain to us what kind of dressings or what procedure she would like done on the patient.
Okay, and so now typically the reason that we do this here is it really saves time and travel and distance for the patient to go to Buffalo, if you will. But so that most of the services can be provided here. Is that correct?
Most of the services, yes.
Okay. And then now if a service cannot be provided here, what happens?
If a service cannot be provided here, we will ask if they have a choice if they want to go to the Buffalo VA to be seen there. There's also the option, if available, that the service can be outsourced to the public. But there's certain criteria that does have to be met with that as well.
Okay, so they could outsource to the public if they meet that certain criteria. And now, Evangeline, we were talking earlier, and you were talking about some of the benefits of VA, that maybe an individual who might have their own primary care physician and they say, well, I really am not sure I want to give that up. Tell me a little bit about that.
Well, one of the great benefits that veterans have is if they've earned this VA healthcare benefit, we want them to avail themselves of it. So veterans sometimes might have a nice long relationship with a provider that they've been seeing for 30 years and think that they'll leave the benefit, the veterans benefit, for some other veterans, but really we want them to take advantage of their VA healthcare benefits too, because what they can do is they can see their provider on the outside and also see a VA provider. Because, for example, maybe we can provide the prescriptions at a lower cost than what their private insurance offers. So as long as they see a VA healthcare provider, the VA healthcare provider can write the prescription if it's authorized, and that's only $9 for a 30-day supply. That can save veterans hundreds of dollars in some cases based on what their health needs are. Another thing I mentioned are hearing aids. Hearing aids are a marvelous benefit for anybody, and you know how costly they can be. So veterans, if they need, can take advantage of getting a hearing aid or hearing aids if needed through VA health care. And that could be a $5,000 and more savings.
Right. And so now, some of the things, I just want to make sure that I understand this, so correct me if I'm incorrect, if I'm wrong here. So if I'm a veteran, and I've been seeing my own doctor forever, and I don't want to leave that doctor or that treatment facility, I can still come to the VA and I can see Dr. Jamal, who is the doctor here. I can see Dr. Jamal. He will coordinate with my regular, if you will, doctor, and then any prescriptions that I need, any lab work that I need, those things can be done here at the VA. My doctor will also get that information. My prescriptions can be filled here. So it really becomes a cost savings. Also, a benefit I can see would be you would have the two doctors would be coordinating with one another, so it would be like a second opinion in some cases. Is that correct?
It's called co-managed care, and yes, you described it perfectly. So we do encourage our providers to discuss the patient's needs and agree upon what the treatment options would be. So we want them to save money, get their care close to home, and make sure that they're having the highest quality of care available to them.
Okay, very good. All right, so now we're going to leave the telehealth room.
We have some more telehealth.
Oh, okay, great. All right, very good. So let's take a walk and see what's happening down there. All right, now we were in the telehealth room that dealt with wounds. This room deals with what?
This room deals with, you'll see here, this is a teleretinal machine. This is a machine that takes pictures of the eyes, the backs of the eyes, to make sure that if you're diabetic, that your diabetes is not affecting your eyes. It'd be called diabetic retinopathy, excuse me. And these pictures are uploaded into the computer and sent to Buffalo so that the doctor out in Buffalo can view those and make her determination.
And then over here we have...
This is the audiology cart, as we were talking about before, as far as hearing aids. The patient would be seen at the Buffalo VA to have their initial hearing test done, determine whether or not that they do need the hearing aids. The hearing aids can be sent here, and we can remotely program them. This is little necklaces mechanisms that we would put on the patient. And then the audiologist out of the Buffalo VA would be with the patient on the computer screen with her computer programming and setting the volume for the patient.
So really, we talk about health care, and I find it amazing that it used to be if you went to the audiologist or the ophthalmologist or whomever you would go to, they would have to physically be there to touch you, to speak with you. And now so much has happened. We've really evolved, and our veterans are really getting the benefit of this. Is that correct?
Absolutely. We definitely want to enhance all of our services for veterans, and certainly we want them to learn about all the things that we have available, because many people don't realize all the things that VA healthcare can provide for them. And really, it's a one-stop shop, and it's close to home. We want to keep people healthy.
Right. And, you think about hearing. Can you imagine if you can't hear the birds sing, or you can't hear the wind, or, what it must be like? So to have hearing aids available to our veterans who do, over the years, lose their hearing, for any number of reasons.
That's correct. I mean, and many times, if they served in combat, firing of guns or any kind of blasts, those kinds of things could affect hearing. So we want to encourage them to file for a service-connected disability, as we were talking about earlier with the county rep or any of the other reps, but they may be able to even get a stipend on a monthly basis based on a service-connected disability, in addition to be able to getting hearing aids for the rest of their lives.
Right. So it's really important that people come in and participate and do. All right. So we're now in the women's health care room. And now this room, I really don't see anything. They don't do any telehealth from here, right?
No, this is no telehealth. This is actually an exam room designed specifically for our female veterans. You will see behind us they have their own private restroom that they can utilize while they're in this room. And right now, Dr. Jamal is our women's veterans caretaker here. Steven Snyder is in the process of getting certified for it.
Okay, and let's talk about some of the kinds of care that our female veterans get. And we had talked about the gynecological care. Is much of that done here? Is that correct?
They can have their exams right here in Dunkirk for gynecology care as well as primary care. So everything is right within this location.
And one of the things that you had mentioned before, and this is really critical because I know we think of veterans and we think of veterans generally somebody who's been, is older. And we have a lot of younger female veterans. And you talked about the in vitro services. Tell me a little bit about that.
That's one of the newer benefits available to veterans. And actually, it's available for men as well as women who may have experienced a service-connected disability, where now VA can help veterans conceive based on whatever that need might be. And that can be a very costly treatment option if you're paying for it out of pocket. And sometimes it's not even available from private insurances. So this is a wonderful benefit for our veterans who might be trying to conceive and can't.
Right. And so we think about the conception aspect of it, but then once the patient becomes pregnant, then what kind of care? Do they still get that prenatal care here? Or what do they do?
Veterans can get prenatal care from a private physician that VA will pay for. And then also we have a lactation specialist, so that's through telehealth as well, and Julie Scott would be able to assist with that. And even prior to the lactation specialist, we do take care of the delivery and cost of it and the care of the child up to 7 days. So then VA does have a nice comprehensive care for women who are having children.
And so that's something that people really don't think about. I know I never thought of that. That just doesn't come to mind automatically. So to know that service is available, not only do you have the gynecological services on a regular basis, but now you have those prenatal care and then the birthing process and all that goes with it. So that is really phenomenal. So that's great. So Kelly, what else is going on here that we haven't touched?
I think we pretty much touched base on it all here in this room.
Okay, very good. Well, let's head out then. Okay, and now we're in the teamwork zone, and we're here with Dr. Jamal. Now, Dr. Jamal, you've been with the clinic for a while now, so tell me a little bit about some of the services that you provide and actually what you're doing here.
I've been with the clinic, like you mentioned, a while. It's been 15 years, and during that time, the services provided by the VA community-based clinic have evolved. Now we provide remote care so that we decrease on the burden of travel to the patients and their families. That is very helpful for veterans who work or who have challenges with transportation. We also provide primary mental health counseling. Remote services include consultation with psychiatry, cardiology, and other specialties that veterans need.
Okay, so in addition to the regular, what we would think of as physical medical, there's also the psychological aspect, the emotional aspect, and now you treat about 1,500 veterans here, right?
Correct.
And now, do you see all of those personally?
No, I have a great team that we work together. Mr. Snyder is a physician assistant. Kelly Dragon is a manager of the clinic. You've met, I'm sure. And we have a great team of support nurses, very competent, very caring and enthusiastic about their mission.
And so now, of course, you know, this clinic is new, and we're very proud to have it here. I mean, it's great. Not to deter or take away from the prior clinic, but certainly with the clinic, the size that it is, with the capacity that you have now, and with the what we're doing with the computers and all the stuff, how you interact between the different doctors and the different facilities, what other changes can people expect?
Over the years, these services provided by the VA have evolved, and now we have a new model in distributing the space and using it to our advantage. And we are very enthusiastic to move to this new facility because it implements a new the new model with the teamwork aspect emphasized among all the team members. And that's a significant change from past experience, and that's being slowly implemented all over the country by the VA.
You know, and you mentioned team a couple of times, and so I know that both Evangeline and Kelly have mentioned that as well. So team is important. Kelly, tell me a little bit about your team here.
Well, you'll see here where we all sit on this side here. That's Stephen Snyder's team, the packed blue team. And then on this end here, this is Dr. Jamal's packed team, the red team. On each team, we have an LPN and we have a registered nurse. And then we have Michelle, who's unfortunately not here at the moment. She is our telehealth nurse, so she's on both teams.
All right, so telehealth is a big deal. Very good, so thank you. Now, where are we headed next?
Well, we can go down the hall and take a look at a couple of the other exam rooms and check out the lab.
Okay, and thank you, Dr. Jamal. It's a pleasure.
Very much.
Take care. All righty. Okay, and we're now here in the behavioral health room, which is properly named for me, I'm sure, because I certainly need some behavioral health. But tell me a little bit about the PAC team. We talked about that. Explain what that is, the components, and how those things, how they provide services and how they're accessed.
So our PAC team model consists of a provider, an LPN, an RN, a nutritionist, and a pharmacist. And both the nutritionist and the pharmacist are available through our telehealth system. On the PAC team as well, we have social workers for mental health. Leslie Oria is here as one of them. Unfortunately, she's off this week. And then Ed Thibodeau, he's here 1 day a week, and then he travels to Jamestown for the rest of the week.
All right, and so the PAC team, basically, so they would handle a particular client or veteran, correct?
Well, these services are available for all veterans, and that's the beauty of it, because there's an interdisciplinary team that works together for the health of each and every veteran, depending on what the veteran needs at that time. They might need some counseling on a prescription that's new, and so they have that discipline and that specialist to help them with that. So really, when people go to their doctors on the outside, they don't always have all of these specialists that are taking care of somebody and making sure that they have everything available.
So really, what, if I'm understanding this correctly, what the PAC team does and what the doctors and all of the members of that team, they really put together a plan for that particular veteran. And they really work individually, so it isn't like it's just everybody gets the same cookie cutter treatment. It really is individualized. Is that correct?
Yes, correct. We also have a licensed medical social worker here as well, who is phenomenal with helping our veterans who may be homeless or facing homelessness or having some other issues with bills that they need help with. She's great with our veterans.
And okay, so now we're here in the behavioral health room. Tell me a little bit what really transpires here and who would come in here or what kinds of services do you provide?
For mental health, it's really just for patients who are struggling with maybe mental health illness, PTSD, anxiety. They'll come in and see their counselor. Like I said, we have the 2 counselors here that provide services for the veterans.
And now Dr. Jamal had mentioned the psychiatrist also. Is that here, or would they go somewhere else for that treatment?
The psychiatry is available through telehealth when we have at least 3 to 4 different psychiatrists that the patient could see through telehealth. Okay,
so telehealth is really a big thing. And he talked about things evolving. That is certainly something to behold. I mean, it is really quite the evolution, if you will. So,
We're modernizing quite a bit with technology in VA, so telehealth is one of those services, as well as vet text, and eventually we have that available through telephones as well. So there are things that we have that maybe other providers don't have available on the outside that we're growing with, and we want to grow more. And one of the other things I wanted to be sure to mention, Vicki, is, you know, when people serve in the military and in combat and they come back from combat, we encourage them to enroll in VA health care right away. And sometimes they need help with transitioning to civilian life, and maybe that mental health support is one of those services that we can be sure to help them with. So we want to encourage them to take advantage of their health care sooner rather than later. And as you know, suicide is very prevalent amongst public health in general, and we want to prevent that. And so getting the help that people need is paramount to keeping people healthy, and we want to be able to offer that here in Dunkirk, and we do.
You know, and that's wonderful. And one of the things, too, that I think is so important is that our mental health is just as important as our physical health. And we've had such terrible stigmas and so many things that have come about that people say, oh, no, you know, I can't talk about this, I can't talk about that. They need to talk about it. And so depression is real. PTSD is real. And these things affect us, and they affect our way of life. So, you know, I really encourage strongly for people to kind of come out of the shadows. If you've got a problem, you know, come, get help.
And we want family, the community, and more people to be aware of some of those symptoms and to encourage veterans to get that care. Because it's available, and people can recover and be treated and be helped. Absolutely,
and our veterans are truly our heroes. So, you know, we really need to protect them if we can. I mean, they're what's important. It's our veterans that keep us free. So that's critical. All right, so now where are we headed? What else do we need to talk about in this area?
We have our outpatient lab that we can go take a look at.
Okay, we're going to cover that, and then we're going to probably have to come back for another day because we could go here forever. All right, outpatient lab, here we come. All right, as we go down the different corridors, I noticed that you've got your artwork and your photos on the wall, which are really phenomenal because they really depict some of our veterans in action, some of the things that they deal with. Tell me a little bit about how it came about, how you decided to select these particular photos.
Well, it was actually our contracting company that chose all the photos. They wanted to make this feel at home for the veterans and to depict, you know, every branch of the military service. And a lot of the photos are from local places around this area and the Buffalo, New York area.
So the veterans might come in here and they would see, oh, gee, you know, I was in the Air Force, or I was a paratrooper, or whatever, or I recognize this particular area. Is that correct?
Correct.
Okay, so this is really a great corridor as we go through here and we see all of these. All right, so we're going to head out. All right, so now we're into our lab area, and so we're in the area where I think everybody will recognize the different vials. So you do what in here?
We do all types of lab work here, lab draws, urinalysis, and they get sent right to the Buffalo VA. We have a courier that comes in daily that picks up the blood and drives it up to Buffalo.
So we do the outtake from the patient here, if you will, or intake, and then it's processed in here. Is that correct?
Correct, yes. We do have our own lab processing here that we can process and then ship.
Oh, very good. And so then on a daily basis, it goes to Buffalo, it gets processed, the results come back, and they're ready to go. So generally, they don't have to wait very long.
No, usually they're usually back the next day.
You know, we talk about waiting, and that brings up something in my mind. There has been so much negativity that's been throughout the media. Oh, the veterans have to wait forever, wait forever. What is the typical wait time for a veteran? I've come back now from wherever, and I want to call and say, I need to come in and get checked up. How soon could you get me in?
As long as the paperwork is processed and they're in our system, we can get them in within 24 hours.
And how long does it generally take for the paperwork to get processed?
Just a couple of days.
So generally for somebody new, there's no emergency. They can, you know, within 3 or 4 days, they can be seen.
Correct.
And now what if it's an emergency? What if I feel like, you know, I got up this morning, I don't feel well, I really need to see you this morning. Can I do that?
Yes, you can. And if your provider does not have an opening, we can get you in with one of the RNs for a triage visit.
And of course, the hours here for the clinic are?
8 a.m. to 4:30 p.m. Monday through Friday.
So now it's 11:30 at night on Saturday evening. What do I do?
If you try calling our clinic, there is a phone number that is at the end of the message that you can give a call. There is a 24-hour nurse call line that is available to the veterans as well, and that nurse call line will advise the veteran what they should do.
So they may say go to the local hospital.
Correct. And if that is the case, we will get all the information the next day when we come in.
Okay. And now, if they go to the local hospital, how are those bills handled the next day?
Usually they just have to contact us and let us know what's going on, and then we'll take it from there as far as the billing process.
Okay, so a veteran should not be worried if they have an emergency at, Saturday night at, midnight. They call the nurse or they call the line, the number, and that person tells them what to do and they need to go. If they're having chest pains, they don't have time to call, can they just show up at the emergency room at the hospital?
Yes, they can.
And so then their family would contact VA the next day or whenever.
Yes, they will.
So really, the VA service really wants to work with the veteran, really make it as seamless and as non-difficult as possible. Is that correct? I see you.
That's true. And, just so the community knows, VA has recently been noted as the 12th top VA healthcare system in the country amongst all VAs. High quality care for our veterans in Western New York. We're very proud of it.
All right, Evangeline, tell me about the Healthy Vet.
Okay, My Healthy Vet is another technology feature the VA has available for veterans. It's an online electronic health record for veterans. In addition, one of the things and features of it is if you have a prescription, you can reorder your prescription through My Healthy Vet. You can view your lab results as an example, and there's also an enhanced version of secure messaging with your provider. So if you have a question, you can email your provider and they'll email you back.
Now, I have one quick question because we talk about all of this computerized stuff. And I know there are a lot of people, maybe not in your generation, but don't use computers. Do you have any kind of training available for them?
There's actually...
Yes, they can come here and we can show them how to use the system. We have a computer out front in the waiting area that is utilized just for My Healthy Vet.
There you go. So you can do that. Tell me, how do people contact you? What's your number, your address?
Our contact information is, our address is 1170 Central Avenue, Suite 130, Dunkirk, New York, 14048. Our phone number is 716-203-6474.
Okay, and you're in the DNF Plaza, just a little bit down from Ollie's, not quite to the liquor store. So if people are looking for it, that's where it is, the DNF Plaza. All right, what else do we need to know?
I think we covered it.
Thank you so much for having us. We really appreciate it, Vicki.
Well, thank you. I mean, I really appreciate it. I appreciate all of our veterans and certainly all the services that you do for them. So thank you. Thank you, residents, for watching City Speaks. You can watch City Speaks daily at 3 o'clock and 10 o'clock. Catch us on YouTube. Go to DunkirkAccess.com. It pops up. You can watch it anytime. Tweet us. Like us on Facebook. Let us know what you like. Let us know what you don't like. Send an email, vwessling@cityofdunkirk.com. Send a snail mail to Vicki Wessling, City Hall, 342 Central Avenue, Dunkirk 14048. Give me a call, 716-363-6888. And thank you. Thank you for watching City Speaks. And thank all our veterans. Thank you.
Thank you.